Dr. Neelima Deshpande, a gynecologist, menopausal expert, and sexual health expert, Fellow of Royal College of Obstetricians and Gynecologists, London, Fellow of Sexual and Reproductive Healthcare, London, specialized in menopause care, female pelvic, urinary, and genital organs, contraception, sexual and reproductive health. She has more than 30 plus years of experience and she has already helped 3 lakh plus women facing challenging healthcare issues. She has a very informative YouTube channel and actively sharing useful tips on her Instagram and Facebook account. Dr. Nilima, thank you for joining us today.
Thank you very much for having me, Nidhi.
Right. So we'll start with some 5 questions where I just want answer in yes and no, and later we will be discussing those questions in detail.
Sure.
Women are quitting their jobs or not taking promotion because they are going through their perimenopausal phase. Is this
True.
true?
True.
Menopause is a modern lifestyle issue. Our mothers and grandmothers had very smooth transition. Is this true?
False.
Severe symptoms of perimenopause in short term do not have any long term impact. Is it true?
False.
Do gynecologists have processes or knowledge to guide perimenopausal women?
Maybe true. Depends on their training.
Women cannot do much to smoothen this menopausal transition as it's natural.
False.
Thank you for having all those quick answer. I really want to touch upon on the first question which we discussed. Women are quitting their job. So you work with a lot of women out there. What is your experience? How menopause or perimenopause is impacting them?
We know that menopause symptoms can range across physical symptoms, psychological symptoms, and genital symptoms. And symptoms in each of these categories is responsible for a poorer quality of life. When our quality of life is affected, our everyday function is affected. So, for example, somebody who suffers with very heavy periods, clotting, flooding, and you show up to work, it's going to be really difficult to cope with constantly making excuses because you got to go to the toilet, or if you're in a lot of pain, or you have to change your pad all the time, or you soil your clothes if the center you're working in doesn't have a toilet or changing facilities. I know women who suffer with incontinence that gets worse at menopause, or they have a condition called overactive bladder, and they can't sit in one place for very long. They need to go to the toilet. And many workplaces have restrictions on how often a woman can go to the toilet. So when she has to ask to go to the toilet, it can be a really humiliating experience, especially if the workplace is such that other women or men have no understanding or knowledge about what menopause, incontinence, heavy periods is about. Same thing, is about hot flushes. You're suppose take an example of a woman who's leading a board meeting and she's menopausal and she stands up to give her presentation and suddenly she breaks out into a hot flush. Momentarily, her heart rate goes up, she feels anxious, she feels sick, she has to sit down. And what are the comments in the board? Oh, it's that time of month. Oh my God,
Right,
she's just a menopausal woman. Oh my God, look, we've got to deal with this. Why doesn't
right,
she just sit at home? Etc. etc. Psychological symptoms, the mood swings, depression, anxiety, fear of job losses, financial difficulties. This creates a lot of interpersonal stress at work. And we see many women leaders who end up losing their temper, getting
right,
angry with somebody, being provoked very easily, and therefore being manipulated easily. And then the depression and anxiety, something that you can't rid of, and the constant feeling of, I'm just not good enough. Maybe I'm not
right.
cut out for this. What am I doing here? Maybe I should just sit at home.
And
And then,
is it
is
worth
it worth
taking
it?
all
Is
this?
the money
Yeah,
worth it? And the psychological symptoms that the consequences at home, for example, with children who are going through puberty. Oh, my mother, she's constantly, she really doesn't have it sorted out. She's like,
right,
oh, lost it completely. Or the husband will say, why do you have to go to work where it's bothering you so much? Why can't you just sit at
right.
home? The loss of libido, the loss of communication, the closeness, intimacy, the difficulty with having great intimacy and sexual life, the breach in the relationship, or maybe if she's widowed or separated,
Right.
the incidence of workplace related relationships and how to manage them, the stress of different kinds of problems at work that then affect sexual function, bowel function, etc. So each area of menopause can end up with the woman being affected. So she's not able to perform optimally in her work.
Right.
And then that makes her question herself and the people at work question her
Right.
ability to show up.
Totally. And what we need to understand, usually women are at that place, 40, 45 are at mid-level management. So the responsibilities are a lot. It's not
Yes.
easy. The responsibilities
Mid
are a
or
lot.
even upper level.
Upper
So
levels, right?
yeah, so between the ages of say 35 and 55, you see middle
Right.
management, and
Right.
between those who are really like rapidly growing in their careers, even between the ages of 50 and 65, is there'll be
Right.
CEOs, CFOs, COOs of their companies.
And then there are a lot of people looking at you like what you are doing, and then you are not able to stand to those expectations. At times I'm hearing it a lot that women finally decide like, okay, let me take a break. Is it this worth? I'm not feeling comfortable, my body is not there, it's my body is giving up on me. So yeah, this is the this is a real case scenario, and that's why we see as soon as mid-level management we still have women, but as soon as we reach to that executive level, then you don't see, there are just like board members and hardly a women out there.
Yes, very
Right.
true.
I also want to understand this point in detail. Everyone, if I'll, my mother never told me what is menopause, and she had this smooth transition. And you girls, what is happening? You are probably not eating right, or you're not doing right things, because this is a new generation problem, is it?
Partially right because, and I'll say two important reasons. One reason is that of her generation, not many women actually got an opportunity to go through menopause. So, like my grandmother and maybe your grandmother, there weren't so many elderly women at that time. If you consider life expectancy at birth in India at the time of independence, which is not that long ago, 75 years ago, life expectancy of women was only 38 years, which means the majority of women did not even reach the age of menopause. In the last 50 years, because of medical advances, particularly anesthesia, blood and blood products, different kinds of medicines that have come about, women are surviving complicated childbirths, many, many medical emergencies. So now our life expectancy is higher. So today, a woman born in India can expect to live up to 80 easily. My mom is already 88, so I can expect to live to 90. So, for the last 50 years or so, and this is a phenomenon not just in India, but many developing countries and also developed countries who in the past would have seen women living up to the age of 80. Now, the sheer number of women who are reaching that age has increased. So,
Right.
menopause as a specialty, actually addressing all of these problems, is a very young specialty. So at the time our mothers were going through these problems, they didn't have names for symptoms.
Right.
So they didn't think this was because of menopause.
Right.
So I remember when I was doing my internship in a village called Srirampur in India, and I worked in a hospital that was run by the German missionaries. And there used to be a separate outpatients clinic run for females and a separate outpatients clinic for males. And the our CMO's wife was an anesthetist during the daytime, and she used to also cover the female OPD,
Right.
outpatients department. And none of us wanted to work in that department because every single woman who showed up had the same complaints. I was like, oh, I'm feeling like there's hot air coming out of my head. I feel like there's hot air coming out of my ears. I'm crying for no reason. My heart is hurting. I feel like something's choking me. I can't pass urine. My urine is burning. Can you treat my infections? My joints are hurting. Blah, 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 blah. And we used to hate it. Like, once or twice we went and sat with her. I was like, this is so boring. And the only thing she would say, yeah, yeah, it's okay. It's okay. And she like give some lip service to it and prescribe them some iron and calcium. That was the end of it. Today, when I look back at that experience and see what those women were going through, I feel, my God, we did them such a disservice. We were not able to recognize menopause symptoms and we were not able to give them the care that they deserved. It's very heartbreaking to realize that a whole generation of women have passed through the clinics
Without
of
it.
doctors without ever being acknowledged for
Right,
their
right.
symptoms.
Totally. I also understand, as you said, the life expectancy has changed, but we also need to understand women are much more, they are working these days. The demands are
Yes,
pretty high. They are not at
yes,
home where they can take afternoon nap, and they can, when the kids are out, they can relax, chill, talk to someone. Now the stress levels are like skyrocketing, and with that and the work pressure, women are now, they are exposed with their symptoms, which was not the case 30 years back.
Yes, and also the women who are my age, we're privileged because we actually got exposure to a decent nutrition. But the women who are slightly older, the maybe 10, 15 years older than I am in their 60s and all, they came through an era where they lived on rations and, the food quality was not that good.
Right.
The contrary problem now is that the girls who are growing up, they're growing up with very poor food quality. They got a lot of food and they've got a lot of processed food, but the soil quality is bad, the water
Right.
quality is bad, the air quality is bad.
Bang.
Everything we have is contaminated with petrochemicals, pesticides, preservatives. So these things are creating huge hormonal problems in our bodies.
Totally. And I just wonder it every time, like girl who are at their 13s and 14s, and they are still, at this age, they are facing all this hormonal issues. What will happen? Like they have a whole 40, 50 years of reproductive age. What kind of
Yes,
phases they need to go through?
yeah,
It's
it's
very
very
hard
difficult.
to, yeah, even think of. Uh, with respect to gynecologists, so most of the time I hear this like, hey, I am facing this symptoms, I go to the gynecologist, and at times there is like, hey, go home, take rest. So those process and that knowledge is not, probably not a part of the standard medical process, or it's not so detailed out.
It is there because we all get, as a gynecologist, I got training about menopause. When I was in medical school, we, like I, showed you the example of that female OPD. We didn't have role models of doctors who were willing to take that up as a specialty to treat it. In a country where the population is huge, we used to have outpatient clinics of 250, 300 women plus. So what happens is that in busy clinics, doctors also end up doing what you call firefighting. So you manage the most urgent things that can be cured quickly or solved quickly to give a result. Now, if you consider menopause, the symptoms can begin as early as your late 30s and it can continue well into your 50s and 60s. So it's a chronic health issue that needs managing over 10, 15, even 20 years. There is no medical establishment, a big hospital, that can cater to the needs of women for that length of time on a constantly changing basis because the symptoms are not static. These doctors are more able to deal with somebody who has a heart attack. They
Right.
can manage the heart problem. They have alcoholic liver disease, they do a liver transplant. They have a kidney problem, they do a kidney transplant. They have a neurological problem, they prescribe medicines. But menopause is complex. And any standard medicine, and I see patients like this every day, for one problem, they go to a psychiatrist. Oh, I've got depression. Then they're not sleeping properly, they're snoring, they go to an ENT specialist. I've developed diabetes, they go to the diabetologist. My blood pressure is not getting controlled, so they go to another physician. Oh, my mother had breast cancer, so they go to a breast cancer specialist. Oh, my sister's got some other problem, so they go and visit, the ophthalmologist or the dentist. Each one of these specialists are doing their job, fixing their organ, but they have no concept of the whole. And just
Right.
this morning, I was talking to my brother and saying, the human body is quite magical. The sum of the parts is much more than just putting them together.
Right. Totally. I totally understand what you are bringing on, what you want to highlight, that the doctors are taking care of the majority or the urgency, or where they have to do some surgery and operate. On the other hand, menopause is like a transition phase where you need to understand it. I think it's a multidimensional place where you need to understand about how society is supporting you, how your family is supporting you, some kind of nutrition deficiencies which you can manage, some kind of medication, some issues can be handled with medication. So it is a like wide variety, and as you said, like in this 20 years phase it will change, it's not constant, it is changing. So the demands are also changing, so we don't that kind of one doctor and 20 patients out there, that menopausal women will never get that kind of time which is
We
required
need
for.
a dedicated specialist who can coordinate all of the different care that that woman needs.
Right.
And in modern medicine nowadays, there is a concept called biopsychosociocultural approach to managing disease, And we know many chronic diseases, for example, diabetes or even HIV, AIDS, or Alzheimer's. All of these are diseases that require a biopsychosocial-cultural approach. It's not just a medical approach.
Right. But that's the new concept. I'm sure I need to learn more about it, but we'll be discussing more in our next podcast about that. I want to come on now on your journey. I just wanted to first start. What is your first memory? Like when you experience something like different happening to your body and you are unable to understand? And what was that memory? Is there something like your menopausal first memory that, okay, this is something new happening to me? uh, i-
I went through quite a challenging phase because when I was 36, I underwent spinal surgery two
okay.
times. And I was very, very sick for over 12 months with depression, anxiety. I lost my career, I lost my job. I had no idea what the future held for me. I didn't know if I'd ever walk again properly. I could barely walk a few steps without being in excruciating pain. And those years, those 15 years that I spent rebuilding my career, rebuilding my mental and physical health, I didn't realize that the challenges I was facing at the time were overlapping with my problems relating to menopause. It wasn't until I went through my 50th birthday that I could look back, and I went through 50th, maybe 51st birthday, when I started to improve, that I could actually look back and say, hang on a minute, all of these symptoms are correlating with the experience of menopause. All of the women I've seen who are going through menopause. I had the fortune of being able to introduce nutritional supplements. And what happened was nothing less than miraculous. Within 3 months, I was able to come off the majority of my painkillers. I was able to come off my antidepressants. I was able to come off the medicines that I was prescribed, like gabapentin for chronic pain. And it was then that it hit me that what I was experiencing wasn't just the consequence of my spinal surgery, it was something more. And then when I started researching and really documenting and tracking my symptoms, I realized that what I was going through was a combination of the after effects of my spinal surgery and the complications of menopause. It wasn't until I decided to sign up for health insurance and I went to have my ECG and stress test done that I realized that I had early changes of ischemia on my ECG. And considering that I was pretty fit and I was already going trek, I had become fit in spite of the spinal surgery. I had improved my fitness to the extent that I was going trekking. I was climbing a whole lot of mountains around here in Pune. I was swimming. I was traveling up and down in the bus. I was doing my work. And I thought, this can't be right. And then came the genital symptoms. So I knew because of my spinal surgery, I would suffer consequences of bowel and bladder issues. And as a urogynecologist in the UK, I had seen enough women going through menopause with bladder problems, and I dreaded it. I was like terrified of the fact that I was going to end up just like one of my patients on lots and lots of medicines, being depressed and horrible and leaking urine, and just it was my worst nightmare. And that changed as well. So as soon as I started taking these supplements, my frequency of getting, I went from waking up 6 times a night to just waking up twice. I thought, this is funny. I'm not on any other kind of medication. How come just taking nutritional supplements can change my life so much? And that then triggered me into actually starting to seek more holistic solutions for my symptoms. But that's kind of, it was more a retrospective realization
Retrospective, right?
of, suffering the consequences of chronic pain, depression, and anxiety, and then realizing that it blended into menopause symptoms so, what do you call,
Well, right. And I'm
unrecognizably.
and I'm just wondering, so the suffering was almost 15 years, 14 to 15 years.
Yeah, I still have it, but
And
I'm like less than 5% of what I started off with.
right, and then there was nothing. You were on medications and nothing. There was no check on supplementation if there is any kind of deficiency which can be handled and symptoms can be reduced. And it is like you have suffered the whole way, and towards the end you realize like this is the thing which probably I would have done. I would have tried this. That's and I'm sure all your journey, all your learnings are coming from the place that I don't want anyone else to suffer like that. I just don't want any women to go through this.
Absolutely, absolutely.
Just tell us a bit more about your symptoms, like what are the key symptoms. So during this 15-year phase, were you working or how was it, on and off? How was it, and what are the key things which you think that you lost during this time?
I did go back. I started back in sexual and reproductive health. I retrained in sexual medicine. I started to use my knowledge of pelvic floor dysfunction and urinary incontinence when I was managing women with sexual dysfunction and also menopause. So I retrained as a specialist in menopause with the RCOG. I was working with the Faculty for Sexual and Reproductive Health. I was on the journal committee as well. I used to travel a lot. And I remember just being so exhausted while doing that work. I pushed myself to rebuild my career, but I remember being so exhausted. I would start work on Monday and I was working part time. I couldn't work full time. By Wednesday, I just wanted to go to bed. So I pushed through Thursday, Friday, and Saturday so that I could rest most of
Okay.
Saturday and Sunday. And then I realized that I couldn't function. So I started to book my holidays, my annual leave every 4 weeks on a Friday and a Monday. So I would get 4 days to sleep and rest.
A huge lots of productivity. Almost you were functioning at 30% of your productivity.
Less than
L-
that, I
Yeah,
would say.
yeah,
I didn't have the mental capacity to think about the next week. I think I would live just day to day.
right,
I had a
right.
huge amount of social anxiety. I really dreaded meeting people. I was in so much pain that I remember being afraid to stand near doors or climb a staircase if there were a lot of people on the staircase because I couldn't feel sure that I wouldn't be knocked over, whether I would be able to protect myself, whether I'd be able to hold on and balance. And actually, I remember I remember one instance where, as a consultant gynecologist, I was standing outside the doors, the double doors leading into our office space, and those are very heavy fire doors, and I couldn't open the door.
This
I
is
couldn't open
this
the door. It was too heavy. And then one of our senior male consultants, he pushed me from behind because standing, I couldn't open the door. He opened the door. So it actually, as he opened the door, it hit me in my face. And he went
right.
through the door and he let it close behind him.
Okay, I think he has no idea what you are going through or what you are trying to do or whether I should help her, should I ask her. So totally
So
like
when I faced
unaware.
those kind of circumstances, that ended up with me leaving that job because I just couldn't take it. I didn't have the mental bandwidth to actually cope with people, with having a conversation. I remember being on labor ward. I was doing labor ward duties, and I was standing at the bed looking at a patient's notes. And I turned the page after reading it, and I'd already forgotten what was on the previous page.
Right, right. And this
I
is mind
remember.
fog, and this is people are unable to relate to it. They think like, okay, this is just happening. No, this is perimenopause. This is such a symptom of perimenopause.
Yes. And because for me it was complicated with being in chronic pain, I remember seeing one of the occupational health consultants and saying, I feel like I'm permanently walking with a helmet. So I don't know if you, it's like a helmet through which you can only see through reverse binoculars. Everything seems like really small, far away in black and white.
Yeah, I cannot even imagine, but I totally understand. I'm just reading about it and, knowing about it, but being in that situation. And I'm so glad that you are so strong today and you are doing all this work where you are actually, I was going through your testimonials. You are actually educating doctors because there are a lot of doctors who need that kind of multidimensional approach with respect to their patients. Women are reaching out to them. So if they can think not just with respect to medicine, but rather fitness, mental health, support from the society, together in all the aspect, then only menopausal women can have better experience. And we have another 50 years to live after menopause, so we need to think about it. That is very, very important.
Father developed has developed dementia in spite of being an ex-army officer, super fit, very dedicated, very particular, always followed instructions. He still developed dementia, and I think this brain fog really put. He didn't have dementia when I was going through brain fog. He's developed it now, but just the thought that I might lose my brain, that I might lose everything I ever studied, was terrifying enough for me to actually study harder.
That's so important, and living in that fear, I think you are at that point that okay, I'll probably will lose everything. I'm anyways, my sight is reduced, my knowledge is reduced, I'm unable to remember things. Mind fog is there. It is 20% now. You never know, it can be zero. in a couple of days. You are always in that fear, which is so tough to manage.
I think the other symptom that I have to talk about is the depression. And I remember being suicidal. I wanted to die. And I was lucky enough to have some friends who were there for me and who were encouraging me and, helping me with counseling or recommending certain books and music. And I started to study music. I started to play a musical instrument. And through the help of other colleagues, I managed to get myself two dogs. So I realized because I was able to reflect about my depression and the suicidality that I couldn't allow myself to do it. So I found the two dogs. I said, as long as they're alive, I need to stay alive. So I found an anchor to stay alive. And I did caring for them, taking them for walks, and they were very challenging. The first dog I had was really difficult. I used to be in tears most days looking after her. But then she settled down, and then the other dog became my anchor. When my first dog passed away because of cancer, the depression came back again. And that actually led me to leaving my job in the UK and coming to be with my parents here. My father at the time, he said to me, "Don't worry, you come back. We'll be there for you. You don't like, this is not the time for you to die."
But
But this is overlooked. I lost two friends to suicide between the ages of 50 and 55. And if you look at the statistics for women committing suicide, there is a fourfold increase in the number of women committing suicide between the ages of 50 and 55.
yes, and it is I think all this information is missing. We are not being prepared enough for that. We are prepared enough for pregnancy. Women reproductive organs are always seen as like you have to deliver baby, and once it's done, no one is caring about like
Nobody's
what is
interested.
happening. So we are not prepared for that. I also want to understand when you start sharing your symptoms with like your friends around, with your family around, what kind of support, what kind of reactions you have received.
I didn't get any. And my mom is pretty much like your mom, even
Right.
though she's a gynecologist.
Oh,
She's like, big deal, start behaving yourself, get on, do what you're supposed to do.
yeah, don't
You're
think
a
about
doctor.
it. Yeah.
You're a doctor, buck up.
Show
It's not
strength.
like, yeah, do whatever it takes. There is a approach in society that women who talk about their suffering need to be punished, or they're not allowed to talk about what's going on, or that they're mad. I know many men says, "Oh, she's a mad menopausal woman," or she's constantly complaining, or she's depressed, or she is non-functional. She's of no use. If she's useless, then she doesn't deserve to be around. You only deserve to be acknowledged if you're useful to society. Otherwise, not.
I think the whole society is being like something new you're facing. Try to be manage on your own. This we don't have any space for this thing.
You said your mother said we didn't suffer, but I want to tell you a little story here. My mom's mother, my grandmother, and I'm guessing this is around the time of menopause, she started to develop psychiatric problems, neuropsychiatric problems, which are well known to increase around menopause. So delusions, schizophrenia, hallucinations, and she was taken to a psychiatrist and given medication. And for a long time, because she was in pain or discomfort, she would be lying down or not able to function. She used to be exhausted. She had six kids. She couldn't like cook or whatever. And a lot of that burden was taken over by my mom. So I kind of understand why my mom was so resistant to me taking rest or lying down because of my fibromyalgia, because she'd seen her mother do that. And she had taken on the burden of looking after the family, cooking and studying medicine and coming back and looking after her mother. Later on, my grandmother improved significantly and she got back to work. But those 5 or 10 years that she was suffering with neurological and psychiatric issues, they were a big burden for the family and nobody wanted to acknowledge it. But menopause and neuropsychiatric symptoms, cognitive decline, problems with memory, hallucinations, delusions, tiredness, exhaustion, inability to function, not being able to coordinate, not being able to correlate things, not remembering recipes, putting too much salt, too less stuff, not remembering where you put things, mishandling finances. This can become a burden on other people who are not willing to take it on. And it creates a
Right.
lot of resentment and anger.
So in place of understanding that what that lady is suffering, and that's the difference, right? If you have a fracture, everyone is aware. that you have a fracture in hand, you have to, you need to support, we need to support, we need to get the food for you, we need to take you to the washroom, everyone is there because they can probably experience that. But this is something no one is experiencing, and then they were like, hey, this is too much, you probably control yourself, you don't show us this, we cannot take this anymore. So it is more like,
Typically, yeah, and like typically the symptoms my grandmother had, nobody would be talking about it. Oh, she's not well, so she's sleeping. So no
right,
wonder women like your mom would say, we didn't have any problems. Yeah,
totally.
she was one old lady who had problems, but nobody correlated it with this menopause phase that actually affects brain structure and function.
And so this is so empowering, and every time I just feel like I need to talk about this. My mother life was totally different. She was a homemaker, she was at home, things were being sorted, she has time for herself. If she has to finish something in 4 hours, and if she is doing it in like full day, who cares, right? She is at
Correct.
home, she is the queen of the house, so no one questions. But people like us who are in a workplace, we have to perform, we have to show. For the majority of my life as a professional, as a corporate professional, I was just, oh, nothing has happened, everything is okay, I have to show up in the meeting because I have to be at par with my male colleagues. I cannot be like, oh, today I have pain, I cannot feel, I'm not comfortable, I cannot show. I was, every day I was just pretending. And now I have an 11 years old daughter, and I just don't want her to do that. I really want whole society, she should have that voice to put her discomfort across and talk about it. And yeah, that is a mission in life. Let's make this noise, that tell this to the world that we are suffering and we need some comfort. And if we are telling this, it's real, it's not something which we are in our head and we are creating it.
Absolutely.
Right. I also wanted to know, like, during this phase, I'm sure you are a doctor, but still there are people around who will come with some advice. They will like, why don't you, Neelima, why don't you do this? Neelima, why don't you do this? So, what was the most ridiculous advice you came through?
Eat less. You eat too much.
Oh my God, this is like totally contrast. You should take care of your nutrition. In place of that, they were like, cut down on your meal. Amazing. Tell
Or
us. Hmm.
just, I remember when I came back from UK, I was in a lot of pain. And I used to be awake most of the night because I couldn't sleep, either because of restless legs or the fibromyalgia. Every time I stopped moving, the pain would flare up. With fibromyalgia, typically, when you're moving, the pain reduces. And when you stop moving, it flares up again. So, when everybody else would be asleep, I would be awake at night. My legs would hurt, my back would hurt, I would have really severe headaches, my joints would hurt. I remember not being able to walk because my feet hurt so much. I couldn't shake hands with people because my fingers hurt so much. I couldn't write because my fingers were hurting. I couldn't eat because I couldn't chew. All of this would hurt a lot. I couldn't comb my hair because my shoulder would hurt. I couldn't even, my scalp would be stinging and burning. And so I'd eventually fall asleep at about like 6 o'clock in the morning. My dad at the time, he would bring a radio and switch it on at 7 o'clock, blaring music, saying, "It's get up.
So
It's 7 o'clock. You're supposed to get up now. You're supposed to get up now."
yeah, I know, and he is just doing the right thing, which probably his father must have done it for him, and he's just taking that legacy forward
Yeah, yeah.
without real.
Early to bed and early to rise makes a man healthy, wealthy, and wise. I can't bear to see you like this. How will you become healthy, wealthy, and wise if you can't get up on time?
And they have, and he has no clue what all pain you have gone through that night, last night. So yeah, I know. Tell us a bit about your journey, how you decided to become a menopause expert. I know these days you are teaching a lot of doctors and people out there. So how's that journey, and what is your mission? What is that you want to achieve?
That time when I had that abnormal ECG, even though, and then I decided, God, I saw this for a long time. I thought I've been studying nutrition since I was young. No, nobody knows how to teach me. But I also realized that excess weight I was not able to get rid of, belly fat I'm not able to get rid of. I'm borderline pre-diabetic. My ECG is abnormal. My urine examination isn't okay. I feel okay. My body's okay, but what if I've just got used to being sick? What if I don't actually know what it's like to be without pain? And that led me to take up a program called WildFit, which is a program about nutritional anthropology and food psychology run by Eric Edmeades. With a lot of resistance and skepticism, I did that program. But I remember within 6 weeks being so completely transformed. My pain went away. I couldn't, and I was able to take up a new job in Bhutan. I was able to climb 4 flights to my flat. I was working day and night as an obstetrician gynecologist. I was associate professor there, and I had no problems performing. No problems. My brain fog completely disappeared. No medicines, no painkillers. After living 15 years on almost like 4 to 6 grams of paracetamol without caring about my liver function, same kind of quantity of ibuprofen, topped by gabapentin, topped by amitriptyline, topped by sertraline, topped by citalopram, you name it, and I'd swallowed those tablets for the 15 years before this. To go from that to completely no tablets just with nutrition alone was magical. Then the next step came with Indian martial arts. So I found a teacher, Dr. Jyoti Senthil Kannan in Pondicherry, and he was teaching martial arts online soon after lockdown. And that is when all the online classes started. I have been a martial arts enthusiast since I was young.
Yeah.
I was a green belt in karate before I went to the UK. So when I saw this, I said, wow, Indian martial arts and functional fitness. And I just jumped into it. I was born for that. It was the most amazing, liberating thing I've ever done. And I was like, super. And I said, wow, this is magical because my mental health transformed, my body aligned, the right and left, the symmetry started to come back, my belly fat went away, my jawline became slimmer, my hand pain disappeared, my bunions. It was just amazing how my body transformed within 3 months. And then I found Hollow Body and 10x, both of which allows you to tune into your body and find what's my body need now. And then 10x was about building strength, building metabolic strength, cardiovascular strength, muscular strength. And it took my martial arts practice to the next level, to the point where, imagine, I'm somebody who couldn't even walk in
Couldn't even
2000,
open the door of the
couldn't open a door.
yes,
I
fire door.
competed and I got a world record in Karlakattai in December 2023 with the support of my teacher. And this is
Amazing.
following a really bad neck injury. I had a bad fall in June and I couldn't even move my neck. So he gave me this exercise. So you do this, your neck is going to, no physiotherapy, no painkillers. I did that through. I achieved the world record and I healed my neck. So that was
Amazing.
like, I proved to myself that when you have the right mindset, you have the right nutrition, and you're given the right movement, your body can reverse pretty much anything it comes across. Anything.
And what I
And then
understand,
now, yeah, I got
it
my
is 9 weeks to that 15 years of suffering. So it is not like it has
magical.
taken you years. It is just 9
No,
weeks.
fascinating. It's fascinating. And I immersed myself in a mental fitness program called Positive Intelligence. It was founded by Shirzad Shamin. Now, I've been a Vipassana meditator for many years, but I realized when I did this program, the mistakes I was making in my meditation, the amount of expectation I was placing on myself, the punishment for not performing, for not being able to sit for 2 hours a day. I'd really criticize myself. Your back problem, you should be able to sit for 2 hours and observe it. You're a senior meditator. Da, 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 da. In the name of meditation, I was punishing myself. And it wasn't until I started practicing positive intelligence, I immersed myself in positive intelligence mastery program since last year, October. And I have realized that the empathy, self compassion, kindness that was completely missing in my life, in the way that women are also treated, was the missing key to transforming my mental well-being, my physical well-being, my fitness, my commitment to my fitness, my commitment to my nutritional health. Because most of us women who are my age would have been on some sort of diet every year of their lives
Right.
for a few weeks at a time. Lost weight, gained weight, lost weight, gained weight. Most of us would have been on some sort of exercise program for a few weeks at a time. I mean, I am part of the gang that pays to go to the gym but doesn't go.
I know.
So
Majority lie in that bucket
yeah,
only.
but positive intelligence, mental fitness helps you to align with your goal and purpose. So you actually start to gently guide yourself into acting in your own best interest. And that has been incredibly transformational.
That's amazing. And the good thing about the way you have explained it, it's a very multidimensional approach where you are thinking, you are aligning your intention with your goals, how to take it slowly, how not to be worried about. And what you said, right, hitting yourself hard, why you are not doing this, why you are, and every time you are creating further burden on your shoulders, and then it is a cycle of negative thoughts. It's a cycle. So I always tell my clients, right, treat yourself as you treat your kids. So you'll tell your kids like, okay, you improve, and then you'll be at the same time, you'll go and hug, and you're like, okay, no worries, try next time. Same way, be empathetic to yourself as well. Love yourself. I think that's the thing. You have to be caring towards yourself. That was amazing. We'll just quickly cover few more questions regarding your experience with Indian women, like women out there, because you're working with a lot of women. How early, most of the time, what are those early symptoms with, because there will be a lot of women who will be listening to this. What are those early symptoms of perimenopause which will be coming up in their late 30s, and so that they can start taking care of themselves? What are those things, what are those clues? If you can shed some light on that.
Answer this question in two parts. One part is the women who need to be aware that they already have health conditions that can cause them to have a less than optimal experience at menopause. So these are probably girls who've had polycystic ovaries, girls who have been on steroids for maybe asthma or any other kind of autoimmune condition. They've not been exercising much, led a very sedentary life. Then women who've had a lot of fertility treatment, trying to get pregnant, either because of polycystic ovaries or other conditions. Women through their pregnancies who've suffered with high blood pressure, diabetes. Women who've suffered with postpartum depression, postpartum high blood pressure, and problems like that. These women are a group that will most likely need to be aware of increased monitoring. So we know that women who have high blood pressure problems through pregnancy need to be monitored quite early, even through their late 30s, like 35, 36. They need to step up the frequency of monitoring for their high blood pressure, for their heart problems, etc., and not wait until they're going through menopause. Then the second category of women is the category of women who don't particularly have any significant health challenges, but may or may not start to notice changes in their bodies as they enter their late 30s and early 40s. And the earliest changes that women see are changes in their periods. So they might see their periods coming more frequently, or they might see the periods becoming more heavy. They might notice that the kind of bleeding they have changes. So these women need to be alert. They may start to get hot flashes early in their 40s, and this may change, either increase in intensity. They may go away for some time, because we know that the hormone changes in menopause. The estrogen doesn't just drop like this. There's a swing, up and down and up and down. So women will go through phases where they get hot flushes, and then phases where they don't have symptoms like that. Mood swings, irritability, and increased incidence of premenstrual symptoms like getting bloated, irritable, gut symptoms. I know dental issues, because some women, especially around the mid 40s mark, start to find that they have gum health issues, bleeding gums. They start, the mouth odor starts to change, they start to lose teeth. So this is a very important risk that we go through as we enter our menopausal years, is that there is weakness and change in the quality of the secretions, your oral microbiome, that leads to an increased rate of infections, increased rate of caries, plaque formation, gingivitis, and therefore then tooth loss. And then, of course, tooth loss and problems can also be associated with worsening diabetes. Abnormal thyroid function is another thing. So all of the symptoms relating to diabetes, abnormal thyroid function, are very overlapping with menopause. So again, period problems are very common with thyroid dysfunction. Gaining weight and belly fat is very common with thyroid dysfunction. Having problems with swelling on your legs, feeling tired, exhausted, is very correlated with thyroid dysfunction. And then the other one is called anemia. So if you've got very heavy, painful periods, you're going to suffer with anemia. Anemia also overlaps with all these symptoms. So again, the feeling tired, exhausted, recurrent urinary infections, depression, anxiety, not feeling confident, memory loss, swelling on your ankles, not being able to actually digest your food, not feeling like cooking food, not being able to notice, what you're cooking, forgetfulness. these are symptoms of anemia as well.
Right.
So all of these overlapping symptoms start to stack one upon the other as you enter your 40s. And a lot of women start to despair because there are very few specialists out there who are willing to tease these things out. And
Right.
one of the approaches that I ask the women who come to me is, you start tracking your symptoms. And I give them a symptom tracker, and it's available for free from my Instagram. You can download it for free, and you start tracking your symptoms depending on how often they're occurring. So the more frequent the symptoms are, you start monitoring them daily. If there are symptoms that are not happening that frequently, maybe you can do it every month, every 3 months, or every 6 months. So each woman can actually start to look at these symptoms, identify the ones they're suffering with, and identify the range of symptoms that can happen. Like me, I didn't know that fibromyalgia, pain in the joints, is something that
Right.
menopause is going to aggravate. I didn't know gut health issues was something that menopause aggravates. Irritable bowel. I didn't know that not being able to sleep properly was a symptom related to menopause until I actually studied it.
Totally, totally. And I'm just wondering, that's the thing. You are a gynecologist, so a doctor, a practitioner, and it is always like this. Doctors are always right, and anytime something will happen, we'll go to the doctors because that's the best place where you can get all the right knowledge, all the relevant information. And it is hard for me to even imagine, like, women who is probably mother of two kids doing a 9 to 5 job. How it is so hard for them to even think about it, right? How to write things down, how to at least understand that this is not normal and this is little different from what my history has been. Yeah, I think, as you mentioned, that it is important to be mindful of what you are experiencing, and writing is a very, very good way, because you have a very short memory. It is not easy to collect. So if you write it, and you probably can combine your symptoms, you can go to the doctor and show, like,
Yeah, and
these are the
menopause is
things.
confusing. And menopause is confusing because for some time you might have the symptoms and then they go away. And then you kind of second says, was it, am I going mad? Like, didn't I have last week? I had this. What happened to it this week? So no, who's
Totally,
going to believe me? Who's
totally.
going to believe me if I tell them, like, last week I had this problem, but this week I don't have it? But
Anyways,
if you,
people are not trusting you and telling you you are losing your mind, then telling
yeah,
telling
yeah.
them this thing, they will
No, so that is why it's important to track your symptoms, because when you start correlating it with your menstrual cycle, you start correlating it with the other symptoms you're experiencing, you start correlating it with the exertion you're doing, your lack of sleep, you're correlating your depression and anxiety with your sleep problems, your period problems, maybe you're correlating your mood swings with, again, your period problems, with the thyroid dysfunction, with the anemia, so many things that are happening in your life. You can then have a clear picture to actually show your doctor and say,
right.
doctor, I'm not going mad. This is
I'm
really happening to
Yeah,
me.
this is, I've written it. This is a frequency. This is these are the duration. This is the intensity, and this is how these are. And I think with that kind of writing, probably doctor will also get a clear picture. Okay, this is because probably for this we can get suggest these tests. Probably give her this medication, or probably ask her to have this preventive intervention with respect to nutrition, fitness, and stress management.
Totally, totally, totally.
The last question, where I want you to tell us at least three things women should take care of, like, themselves in a way, so that they can reduce the impact of perimenopause once they enter their 40s and 50s. What are those three things they should focus on?
I call them your mindset, your nutrition, and your movement. Under mindset is actually accepting that aging is not a bad thing, and recognizing that menopause is a phase where there are lots of changes are going to happen, and accepting it, and therefore then being best informed about it, educating yourself to then ask for the care you need, is one of the most important steps that women can take to empower themselves so that they have really good quality lives, not just through menopause but beyond menopause. Second thing is to really, really focus on improving the quality and quantity of the nutrition they take. And today we're a society who are overfed and undernourished. The quality of the food we eat. So it's very important to significantly improve the quality of the food that we take in, whether it's vegetables, whether it's meat, fish, or eggs or fruits, and really, really learn about nourishing every cell of the body. And the last one is movement. Until you're well nourished, there's no point punishing your body into exercise. If you exercise without nourishing your cells, you end up damaging your body more. And one of the biggest risks of over exercising in your 40s and 50s is the risk of injury. Because we know as we get older, if you're not nourished properly, your recovery from injury takes a lot longer. So, movement, particularly movement that improves the strength in the large muscles, particularly your hips, your thighs, your buttocks, improves the strength of your shoulder joint, of the back muscle. These are really important in helping your posture, your spine, protecting your bones, protecting your metabolic fitness, protecting your heart. Each of these are individual killers, and knowing that movement will actually prevent the long term consequences of dementia, fractures, of heart attack, of dying and committing
Right.
suicide, even your mental health, being fit is the most amazing thing. So, one of my teachers, Eric Edmead, says, nothing tastes as good as feeling healthy does. And that is really a really good motto to live by, is to become as fit and healthy as you possibly can, because this is your home. This body is your home. If you don't look after it, you will be homeless.
Right. I am religious. I just pray my own body. So I am like, okay, God has given me this, and this is the best thing what I can do. I just pray my body. I just the best care of my body, what possible I can do. So yeah, that's my mantra as well in life. And I have also seen, like, when I was in my 20s, if you ask me to run, like, go Nidhi, just run, I probably will run for 5 minutes, and now I can do a full marathon. So it feels like, oh my god, I have so much power, and I feel like empowered. I like, okay, I can do much more. And I think and that one thing, physical fitness, start reflecting in all aspects of your life, in your
Yes.
relationships, in your profession. You want to do more, you want to really reach out to more people, and it's magical. So thank you, Nilima. It was amazing talking to you. I
Thank
really
you.
want more and more people to get in touch with you, understand from you how they can overcome their symptoms. And I'm not, just wanted to make you feel happy, but I probably want to learn from you as well. And I will be getting in touch with you. But this was such an amazing session. So thank you very much for your time. And will
Thank
again
you.
get in touch with you. Thank you.
Thank
Thank
you
you.
so much.
Bye bye.